Hi guys, this is Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not. Our contact number is 76967342256 for the best OET coaching. This is me, Dr. Bhupesh. You have been listening to me since last 10 years and thank you so much for bearing me for so long. Talking about the letter that is expected as usual, please understand what I'm trying and tell to you all that it is not something that there is specific letter that I can tell you that this letter is going to come, that letter is going to come. Yes, obviously when you are a nurse, the most of the times what you will get as a letter is, suppose if you are a nurse, you are in a situation where you are working in a hospital. So what letter this is the letter we did yesterday was a discharge letter that basically you were having a patient. So please watch this video. I will tag this video at the end. But after this video, you will have a discharge back letter. So there are only three major kind of letters which can come. First is this discharge letter. Discharge letter means I am discharging the patient and I am telling someone to follow the discharge plan. These are also known as follow-up care letters. These are also known as discharge letters. Then the second and the most repeated letters when it comes to OET. The second and the most repeated letter when it comes to OET is a visit letter. But again, please understand these days what OET is changing. They are they are putting up the dates, but sometimes it is not a visit letter. That means the patient is not visiting. Suppose there is a letter of what we have been doing on corona topic. What is happening in that on 15th patient is having some symptoms of COVID. Then patient have some symptoms on 15th. He took antipyretics, something like that has been given. Then after that it says that on 16th patient had fever. Then it talks about something else, but in this particular letter the dates are given, but it is not a visit letter because in the last date, that is last date is 20th round. So in the last date it says the patient visited today. So obviously I can understand if they said that patient visited today, so the previous dates were not dates. So what I'm trying to say is that these days OET is improvising. Improvising means changing few bit of things. So whenever we see any dates, we feel it's a visit letter and we will say this letter is being written regarding this person. But again, I will rather make OET simple for you as I have always promised you, that always look at the last date. What is the current symptom? So in the first paragraph, always write this letter is being written regarding Mr. X who is having this problem. Whatever the current problem is of the patient in the last date, that is the most important thing. So whether it is a visit letter or it is this kind of a different letter, you just say this letter is being written regarding Mr. X. Yeah, who is having this and this problem, full stop. Therefore, he is being referred under your expertise. So this is the most commonly repeated letter which comes in the OET exam, which is the visit letter. But even if it is not visit, so you will ask me, sir, what about these things on 15th? Because sir, we normally write on first visit. This is how we start. Don't write on first visit if it is given on 15th. So you say on 15th September, the patient was having this thing. So you don't have to write the patient was having XYZ symptoms. So the only change you have to make is that you don't say on first visit. You say on 15th September patient was having sick this thing. The following day. Following day means the next day. It's better to write the following day for the next day. So next day the patient was having this thing. Okay. So on the next day, the patient was having this thing. So what I mean by this statement is that even if it is, if by chance you get confused and you say, sir, some people say it was a visit letter, sir. Some people say it was a discharge letter. Suppose if you get confused, what kind of a letter it was, even then this particular strategy is successful. ये strategy तब भी successful रहेगी. This strategy would be successful even if it is a visit letter. On 15 the patient was having this and this problem. Whether he visited, whether you visited the patient, it is correct in both scenarios. Whereas अगर आप, if by chance you write on first visit and later on you get to know that patient did not visit, but later on you get to know that patient did not visit, your letter becomes wrong. So that is why whenever you are confused, that dates are given, but it is not a visit letter. Always write on 15th September. Patient was having this problem, so he took antipyretics. In this particular thing, that is why I teach active and passive so many times. He took antipyretics. That means patient himself took antipyretics. That is why in the case notes also it would be given he took antipyretics. In the case notes also would be given word took. So that will give you a hint that patient himself took antipyretics. That means he did not visit. So these are the different kind of letters. Last to last time there was a letter. It was all good, but it was on the dental data. So again, don't get confused. Even in the this letter is being having who is having toothache in 448 tooth. So 48 number is given to molars. When I did dentistry, I was told 1, 2, 3, 4, 8. 8 tooth in this quadrant, 8th in this, 8 in this, 8 in this. Total 32. 8 fours are 32. So we have 32 teeth. So 48 means that it's the last molar that is affected. 1, 2, 3, 4, something like that used to happen. So we used to divide it in 4 quadrants. So don't get confused. You just have to OET. That is why it is simple. You just write the same thing. Who is having toothache in 48? Who is having toothache in 48? That's it. So you write exactly, therefore he is being referred under your expertise. So obviously you might be writing to the dentist. So what I'm talking about these days, OET is improvising some things, but our basic OET writing remains the same. Don't panic, just write simple. This letter is being written regarding the patient. So it is about today's date. Today's date is always having the purpose. So if letter like this will not come, obviously you know it can be a referred back letter. Referred back letter means GP sent the patient to you. You treated the patient because you are working under a specialist. So patient is better. You are referring the patient back to GP. So you write exactly the same thing in the first paragraph. This is the second, and this has more chances to come tomorrow. Referred back or a discharge back letter. So this is this letter again, same words. I just will copy. This letter is being written regarding Mr. X. So I'm copying here. But one thing I am changing because GP referred the patient to me. So I will, this letter is being written regarding Mr. X, who was referred to us. Was referred means passive voice. Who was referred to us by you. Who was referred to us on 15 September due to high grade fever and vomiting, whatever. Suppose this is the letter. So you are telling the GP that this letter is being written regarding Mr. X, who was referred to us on 15 September by you, but you don't have to write by you. So who was referred to us on this? Rest situation remains the same. After treatment, he is better. So he is being discharged. What I mean by this statement, that first paragraph is about purpose. And in the purpose, you tell the GP referred the patient to you. You treated the patient after treatment. So you say after treatment, he is better. So he is being discharged. Now the main purpose. Being his GP, you are requested to provide him follow-up care. So what you are saying to the GP that this patient was referred to us due to this problem. After treatment, he is better. So he is being discharged. So we are discharging the patient. Being his GP, you are requested to provide him the follow-up care. If you want to make it little better, the only thing you will say, you will write purpose over here. However, he needs follow-up care, and being his GP, there should be a comma before end, and being his GP, you are requested to provide him follow-up care ki jagah the required care. The required care means whatever the care has been written over here. So these are the repeated letters which come in OET. OET is a very practical test. That is what is going to happen when you will be working in hospital in NHS UK or in New Zealand or in Australia. So you would be working in a hospital. Patient will come to you via GP. You in the hospital you will treat the patient, and then you will write a referred back letter to GP that your patient is better, but he needs follow-up care. so you are requested to provide him the required care. So these are the most common letters. Suppose if you are working in a hospital, there can be a discharge back letter. What is the difference between a discharge back and a referred back letter? In referred back means GP referred to you, you referred back. Discharge back means that patient is coming from a specific place. You are discharging the patient back to the same place, like a residential home. Patient lives in a residential home, came to you, you treated the patient, and then you are discharging the patient back to residential home. So what would be the difference? Let's see what would be the difference between the two. So this letter is being written regarding Mr. X. So we will say this letter is being written regarding your resident Mr. X. So that is the only thing I am changing. This letter is being written regarding your resident Mr. X, who was admitted to our hospital, because he was admitted to our hospital. So that these are the few points you have to change. On 15 September, due to this and this thing. Again, rest of the things remain the same. Sorry, this is due to this and this problem. So you tell the problem that patient was admitted to our hospital due to this. After treatment, he is better, so he is being discharged back to your residential home. That is the only difference. However, he needs follow-up care after reaching there. So to the residential people, we can advise. He needs follow-up care. So you are advised to provide him the required care for his speedy recovery. So please understand, these are the major letters which can come. The only problem that you will face in OET is that sometimes letter will have too much of data, but always remember you have to write it that simple. Please do not get tricked. Write in a simple way. Sometimes, once I remember there was an exam. In that exam, what happened, that rather than anything, any word else, it was given that write an advisory letter. So whole of the candidates became confused. What is this? We have never done advisory letter in OET. Guys, when you are writing the words, so you are advised. When you are writing the words, so you are advised to provide him the required care. It is advisory letter only you are advising. So advisory letter is nothing different. Don't get panicked. It is a follow-up letter, is a discharge letter. No, just take it as the patient and try to tell the main problem of the patient and then select your data. That's the only thing you need to do. So again, please listen to this video 2-3 times. In this letter, what we are saying to the GP referred back letter, this letter is regarding Mr. X, who was referred to us on 15 September. If you want to make it better, this letter is being written regarding your known patient. This is the word you can add. Or if the patient was actually referred by GP, so this is also fair that this letter is being written regarding your patient, Mr. X, who was referred to us on this time. So this is regarding your patient only. So we are telling the GP that this is the letter regarding your patient only, who was referred to us on this. Due to high grade fever and vomiting, after treatment he is better, so he is being discharged. However, he needs follow-up care, and being his GP, this is the main point. Please remember this thing. Being his GP, you are requested. Otherwise, this letter is being written due to this and this thing after treatment. So he, over here, the main point is your resident, and main point is he is being discharged back. So in these letters, you write the word discharge back. Over here, you do not write the word discharge back, because you are referring back the patient, not discharging back the patient. When the patient is going back to the same residential home, then he is getting discharged back. डिस्चार्ज बैक वो लेटर होता है जिसमें पेशेंट जहां से आया है वहीं उसी घर में वापस जा रहा है, तभी तो हम कहेंगे हम आपको डिस्चार्ज बैक कर रहे हैं। और रेफर्ड बैक लेटर वो होता है जीपी ने हमारे पास भेजा, हम उसे रेफर बैक कर रहे हैं जीपी को, और जीपी उसको फॉलोअप केयर प्रोवाइड करेगा। दैट इज द ओनली डिफरेंस। सो प्लीज अंडरस्टैंड that no matter, and in these kind of letters, when the GP already knows the patient, when the patient already lives in the residential home, obviously in these letters, my dear, social history and medical history should not be written. because if the patient belongs to GP, GP would already be knowing the social history and medical history. And that is the same thing that applies to even discharge back letters, that if the patient is coming from the residential home, they would already be knowing this thing. So the second paragraph in these kind of letters, in both kinds of letter, will not be social history and medical history. It would be during hospitalization. So that is the difference. And there would be 4 paragraphs, either 2 paragraphs of during hospitalization or 2 paragraphs of discharge plan. Discharge plan, 2 paragraphs, or during hospitalization, 2 paragraphs according to the demand of letter. So in OET, you write 4 paragraphs, and again, 90% in OET, there would be 2 types of letters. It is either write a letter to the community nurse, which can come tomorrow, or it would be a referred back GP letter. Most of the times, community nurse or GP letter. So don't have to panic. Just keep it calm. But these days, OET is doing some variations, like I told you about that dental letter. Don't panic. Just write the same language. This letter is being written regarding Mr. X, who is having toothache. That is why he is being referred to you to treat him. Yeah, that is why he is being referred to you. Dentist ko kaha, that is why he is being referred to you. Social history reveals that he had a toothache in 1992. His tooth was broken. He had an accident, and at that time he did not undergo RCT because he was a kid. After 3 years, he again had pain, but he took painkillers and the pain went away. Pain disappeared or the pain subsided. Today, the patient has come, and today we have given him painkillers, but it is not working. That is why we need your expertise. Maybe he needs RCT. So these are the simple ways of writing OET letter. If OET letter comes in the most difficult form in your question paper, please try to make it the easiest letter and you will automatically pass. Just use the right grammar, use passive voices. Passive voices I have taught you in many videos. If you would have any doubt, I will ask you after this recording, because I don't want to make this recording on grammar. But anyhow, it's not a big thing again. Passive voices are that simple. Passive voices are that simple that these are the passive voices. Whenever any work is done by us, that is a passive voice. Like in during hospitalization, the patient was given physiotherapy. Was plus third form is a passive voice. If it is a today visit, you write today the patient has been given physiotherapy. So this is the only grammar of English. Was given, has been given. That is the only English. So if it is today present passive voice, the patient has been given physiotherapy. That is by the hospital, by us. Or if it is in the past, you say the patient was given. Sir, what if it is a visit letter? So you say on 15th September, the patient was given physiotherapy. Again, in today visit, you will say the patient has been given. So in the past visit also it is was given. Simple. So there is no grammar other than this. Just make simple. And when it is an active voice, which I told you over here, that patient took antipyretics, second form means that he himself took antipyretics. If this antipyretics would have been given by us, then we would have written, so he was given antibiotics. If he was given antibiotics, then obviously it is a visit, because the patient would have come to us. That is why he was given antibiotics. But if it says he took antibiotics, that means he took it himself. So that means it is not a visit letter, it is a date letter. So you don't have to change this thing. But in visit letters, sometimes people have a habit to write on first visit. So that is not very safe. It is good in the visit letters, but if you write on 15 September patient was having this problem, then you can attempt any letter by this method. This will always keep you safe. Again, this is Dr. Bhupesh from Dr. BKM Institutes telling you and reminding you that this is something that is easy to be conquered. OET is one of the easiest exams to be conquered. Stay positive, do your best, and please contact us for the best OET coaching. Thank you very much.